Yes, welcome again to this day. It's a good Monday after a long weekend. There are some topics that we left last week that we have to cover, like anxiety disorder. That's a topic that we cannot leave it. We have to go through anxiety disorder. And as we said, there are some topics that is one word, but they are divided into several words that we cannot leave them just like that because they raise questions and those questions should be answered. And as we said, because time today is limited, as we said, anxiety disorder are groups of mental conditions characterized by excessive fear, worry, and related behavior disturbances. They are amongst the most psychiatric condition affecting people of all ages. Now, the main words here we're talking about is excessive fear and related behavior disturbances. That is what anxiety disorder is characterized by: excessive fear and let's see here, characterized by excessive fear, worry, and related behavior disturbances. This is a psych situation, but it's not as you cannot call someone psych because of having anxiety disorder. Now, there are some types of disorders characterized by this under these anxiety disorders that we will look at. We will go through. This is a simple topic first, so that we go to the main topic today, which is paraphilic disorders and some other conditions that are under this. Now, we continue with the topic of the day, which is anxiety disorder. The main types of anxiety disorders are generalized anxiety disorder, panic disorder, social anxiety disorder. This is a social phobia. And the fourth one is specific phobia, and agoraphobia. Agoraphobia, we will define each and every one of these so that we know what they mean and what they are defined under. We have separation anxiety disorder and selective mutism. Someone asked me last time what is mutism. You will know today what is selective mutism. Now we start by the first one, which is generalized anxiety disorder. You're anxious. What has made you be anxious? Mm. Yes, Beauty, welcome to the platform. I can see Unjani. Unjani, how am I supposed to answer Unjani? Teach me that. When you tell me Unjani, what am I supposed to answer? I think that is Xhosa or Afrikaans. Okay, today we have two topics that we are gonna talk about. Not two, but three. The main topic of today is paraphilic disorder, but we have some other topics that we are going to go through. We have paraphilia and paraphilic disorder, but last time we left on anxiety disorder. I wanted us to continue on anxiety disorder so that we cannot leave it. Ngiafila, Ngiafila, that is Zulu. Ngiafila, nice, nice. I think Ngiafila is like saying I'm fine. I think that one. Yes, yes, yes. I told you to teach me Zulu. Okay, let's continue here. We have generalized exactly. Yes, yes, yes. Ngiafila unjani. Now I know. At least I know one word of Zulu. Yeah. Now here we are saying generalized anxiety disorder. The definition is this: persistent excessive worry about everything, everyday things. You're worried about everything. Those people that get worried about simple things and raising storms under the teacups. Very little things you are worried about. Your health, your work, your finances, everything. Mm? There are some symptoms that you may look at a person and then you come and see that this person may be having this disorder, which is the main anxiety disorder, which is generalized. It is not specific. These are the symptoms like restlessness or feeling on the edge. Your restlessness, always fatigued because of being restlessness. You know, your brain works 24/7. So when you are restless, your brain is using a lot of calories. That's why you feel fatigued. And then there is difficulty in concentration. You don't concentrate. Oh, okay. Let me put my email address there for every private question. You may send it here. Uh, yeah, yeah, that one. Any private message, that is what you can send away from the public platform. Now, we continue with the symptoms of these anxiety disorders. Here we have difficulty in concentration, irritability, muscle tension. This is because of something called lactic acidosis. And then we have restlessness. These two, muscle tension and restlessness, bring fatigue because of high calorie intake by your usage by your brain. Of course, you will have sleep tolerance. You know why? We talked about it last time about the sleep patterns. We talked about it. These symptoms can go up to 6 months or less, but not more. At least 6 months or equal to 6 months, you may say this person is have generalized anxiety disorder. And then we have panic disorder. You know, this one is specific now. Definition is recurrent unexpected panic attack. Recurrent unexpected panic attack, sudden surge of intense fear and discomfort. You're just seated there and then you start having sudden panic and excess fear and discomfort. This one is more, it has problems because it involves heart palpitations, chest pain, sweating, trembling, shortness of breath, fear of dying or losing control. Now, this is a panic attack. Panic attack is different from generalized anxiety disorder in that, you see, here in generalized, we don't have palpitations, but here we have palpitations and swellings. And then we go to social anxiety disorder. Social anxiety disorder. How do we talk about social anxiety disorder? We Let's move away from here. Dorothy, I'm sorry about that. There is confusion. Don't come to my class when I'm teaching again. Let this be the last one. Yes. Sorry about that, people. Okay, okay. Let's continue. Let's continue now. Here we are just differentiating and going about the panic anxiety disorder. Then we'll go to the main topic. We have social anxiety disorder, social phobia, intense fear of situation where one may judge or be embarrassed. You see, this is social when you are around people. Intense fear or social situations when one may be judged or embarrassed. Symptoms: avoidance of social interaction. You avoid people. Social anxiety disorder, because when you are around people, you feel there is something wrong, and then you start panicking. Fear of public speaking. Those people that fear talking publicly or standing in front of many people, they have this problem. Physical symptoms like blushing, sweating, and tempering in social, occupation, or academic functioning. You see, you are in open places with many people, and when you're given a chance to speak, you start trembling and sweating. This is called social anxiety. And then we have specific phobia. Specific phobia, this is anxiety due to specific things. You fear injections. Those people that when they go to doctors, hospital offices or nurses, they start sweating, trembling, having heart palpitations because they have seen the needle. Hmm? Blood injection. You see, situational types like the people don't like getting to elevators. They think they'll fall down. This is called specific phobia. Hmm? Animal types. There are some people fear cockroaches, spiders, and snakes. That is specific phobia. And then we have agoraphobia. Agoraphobia, as we say it, it is fear of being in places or situations where escape might be difficult or help unavailable. You see, agoraphobia, the fear of being in places of situations where help might be impossible, like crowds, open spaces on public transport. There are some people who have never used public transport, developed countries. If you take these people to public transport, they'll fear because they see it is not safe to be around so many people while you don't know them. Mm? Crowds, open spaces. Some people really fear. Open association, this is associated with panic, can lead to avoidance behavior. People avoid other people because of agoraphobia. Separation anxiety, yes, separation anxiety, excessive fear of anxiety about separation from attachment. See that distress when symptoms are like distress when anticipating or experiencing separation. Those people that are in relationships and when they are told I leave you to go and then they start panicking, they are suffering from separation anxiety. You are attached to a person, you are attached to something, you are attached to anything. When you fear separating from that person, you have separation anxiety, refusal to go or sleep away from home because you are attached to your family. So going out or staying somewhere is a problem. Separation anxiety, nightmares about separation. So you know now, those people that cling in relationships that are toxic, they may be suffering from separation anxiety, which can be helped by going to a counselor, psychiatric, or someone who is close to you that can talk to you. We have selective mutism. Selective mutism is a form of anxiety, failure to speak in specific social situations despite speaking in others. Hmm? Speaking at home but not in school. You are very free around the people you live with, but when you go to other strangers, you cannot speak out. This is selective mutism, mostly in children and even adults undergo this. You see, associated with social anxiety. Now, today we have talked about anxiety is just a word, but you see, it's a group of psychiatry complication. Anxiety is just a word, but is a group of mental health condition characterized by excessive fear, worry, and related behavior disturbances. They are among most psychiatric conditions, but we have seen under anxiety, we have one grouped in this: generalized anxiety disorder, panic disorder, social anxiety disorder, and then we have specific phobia, that one we have talked about. And then the other one we have agoraphobia. Agoraphobia, we have said, is those people that fear being in open places or public transport also, fear of being in places or situations where you cannot avoid. We have separation anxiety disorder, and then the last one we have said selective mutism. You are very open to talk with people you relate with, but when you go away, it becomes a problem. Hmm? There are some things that may make you be having these things like biological, genetic predisposition transmitted from your other co-parents, or generational neurotransmitters imbalance. You see, neurotransmitter imbalance like serotonin. This serotonin always comes up every year we talk about the forehead here. You think about serotonin, and then we have norepinephrine, the adrenaline itself. Then we have psychological personality traits. Yeah? psychological, you go our lesson that we learned on personality disorder, you will find these causes there: trauma, learned behavior. Then we have environmental, stressful life. The way we parent our children may lead them to this. Situational anxieties. Chronic illness also may lead us to these problems, because there are some chronic illnesses that make us stigmatized. And then when we go to people, around people, we start fearing. You get it? Now, treatment, mostly, treatment, we talk about psychotherapy. Psychotherapy always becomes number one. Exposure therapy for phobias. Try yourself to have an exposure, and then relaxation therapy. This is psychotherapy. Psychotherapy is divided into three: cognitive behavioral therapy, exposure therapy, and then we have relaxational therapy. But we have pharmacotherapy like fluoxetine. Those are drugs that you can use to relax, like benzodiazepine. Those ones are drugs that you can use. Beta blockers, situational. When you use beta blockers and you are going to public speak, it will help you gain courage. So talk to your doctor, get a prescription for these drugs. Yes, now we have talked about anxiety disorder. We go back to the topic of the day. The topic of the day is paraphilia and paraphilic disorder. Yes, paraphilia and paraphilic disorder. What do we know about paraphilia disorder? Anyone who has ever come out around this, who has ever seen this word, paraphilia? What is paraphilia? Yes, yes, yes. This is a very strange topic, but hope everyone will be keen and listen to what I'm saying. Hmm? Paraphilia refers to intense and persistent sexual interest in objects, situations, or individuals that are type of social unacceptable. Today we have a very funny topic, and I know you have very many questions, even private questions. You send them there so that we will discuss them if time don't favor us. Listen to that. Listen to that again. Paraphilia refers to intense and persistent sexual interest in objects, situations, or individuals that are atypical or socially unacceptable. You know those people that are socially unacceptable. You understand them? If you don't understand them, you pose the question on the platform. While some paraphilias may be harmless if consensual, others may involve consenting parties or distress or impairment. And are they considered paraphilic disorder in our textbook of mental health, DSM? The one that is revised currently is DSM-5. We always, those people that we do mental health, we always refer to that one, which is DSM-5. I'll repeat about the definition of that so that someone may understand. An intense sexual interest other than sexual interest in genital stimulation or preparatory folding with physical, mature, consenting human partners. You see, this may cause distress, impairment, and involve non-consensual persons. You see that. That's why we call it a problem, because now it may cause distress, impairment, or involves non-consenting persons. That is why paraphilias are problems. A paraphilia disorder is diagnosed when? This is diagnosed when we have two strong topics when we come under this. And you see these ones, these paraphilic problems, in forensic studies, the doctors that work with forensics, there are some points that they really go by step, and that's why I want us, as you go through this topic, you take these two notes. One: The individual has experienced recurrent intense sexual arousal fantasies, urges, or behaviors involving atypical stimuli for at least 6 months or not less than 6 months. Hmm? And the second one, clinical significance, distress, or impairment, or involves harm or risk to others. You see that? So when some people do some things and they say they have the right to do it, most sexual behaviors, you come here and listen to this. I'll repeat about this. The individual has experienced recurrent intense sexual arousal fantasies or urges or even behaviors involving atypical stimuli for at least 6 or is equal to 6 months. And the second one, clinical significant distress or impairment involving harm or risk of harm to others. You see that? Now, behind these paraphilic disorders, as you come in, you like it, like as we continue, if you have a question, put it on the platform. If you have an idea of anything that you've come across one day, you may post it. We help you. You may be keeping a question that may help someone else, and that is not okay. Now, types of paraphilic disorders. There is exhibitory disorder, voyeuristic disorder, you see that, fruituristic disorder, sexual masochism disorder, and sexual sadism disorder. We have another one called pedophilic disorder. Yes, there are so many prominent people that are in jail due to that. We have transversic disorder, fetishistic disorder. Those are 8 that we are going to go through. And remember, our definition was this of this problem: any interest and persistent sexual intense other than sexual interest in genital stimulation or preparation folding with physical, mature, consenting human partners. See that? Paraphilic disorder. That is paraphilic disorder. So, what is we have 8 types of paraphilic disorder. Eight. 8 types of paraphilic disorder. So, the first one we start with is exhibitory disorder. Hmm? Ex, 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 exhibitionistic disorder. It's called exhibitionistic disorder. Now, we want to go in details about that. We see what is exhibitionistic disorder. What is that? We have 8. Now, this is a type of paraphilic disorder characterized by intense sexual arousal from exposing one's genitals to unsuspecting person. It is a very funny thing. There's under research that there's some people that when they expose their genitals to other people, they feel nice. We have very, very funny sexual behaviors going on currently, and they are reported, and they have even gone to court. You get it? You get a stranger. This stranger just exposes the genital behavior, laughs, and feels good. You see, how can we define this? It involves recurrent and intense sexual arousal from exposure of one's genitals to unsuspecting person. A person who has no idea what you are doing, you just come expose, and then you feel good and run away. It's like a psych person, right? Hmm? Exhibitionistic disorder. Very funny. A type of paraphilic disorder. The fantasies, urges, or behavior occurs over 6 months. This person, you'll hear people complaining about this person has done this today, this person has done that today, this person has done this to another person the other day. And then you come and realize this person has exhibitionistic disorder. He just came, removed it, showed me, and felt good. The genitals. Very fine. The person has acted on these urges with an consenting person. You see, the other person who is being showed these genitals has not consented. Hmm? Or the urges of significance, distress, impairment in social, occupational, or other areas of functioning. Now you know why people do this. A person just comes and does removes the genitals, shows you because you are unsuspecting and your mind is not there, and then the person goes away. Hmm? There are two main types in exhibitionistic disorder. This disorder has two: exposing genitals to pre-absent children, then exposing genital to physical mature individual. See, sir, there are two types. Some do it to children, others to mature individuals. The pathophysiology is conceptually thought to involve abnormal sexual condition in the dopaminergic dysregulation or early childhood experiences. We saw dopamine is a neurotransmitter in the brain that gives you pleasure. So when someone does this, it is conceptual that there is a problem with the dopamine releasing or the balance in the brain. So this person needs a therapy from a professional to make him or her stop doing this. Hmm? Some individual reports compulsion like features of relief or tension after the act. After this person has done that, you feel this person says he or she has relaxed. You see, that is the first that we have been exhibitionistic disorder. There are some things that may be like this, like you may confuse them with this disorder like antisocial personality disorder, antisocial. Hmm? in in cases involving aggression, and then there is maniac episodes, increased sexual activity, other paraphilic disorder that we will see. This one is different. You just remove your genitals, you shake it around the other partner, opposite partner that is unsuspecting, and then you feel good and be relieved. This one is different, but you don't do anything. You don't do anything. You are relieved by showing. You are you get it. Now, the treatment, most of them are treated with psychotherapy, cognitive therapy behavior to prevent relapse, and then pharmacological therapy like fluoxetine always comes in. Legal forensic intervention. If this person does this always because it's antisocial behavior. This is an antisocial behavior. What you should do, this person should be reported if it is persistent, and then legal issues to be taken so that this person can be taken to a rehabilitation legal institution. For that's why I said here is where forensic intervention comes. There are doctors that work with forensic problems that help in this situation. Now, we go to the next one, which is paraphilic disorder, but voyeuristic disorder. What is voyeuristic disorder? Voyeuristic disorder is kind of a sneak and eavesdropping thing. You always eavesdrop to people, hmm, when they are naked. I said today we are learning very funny things, and you see there are things that are happening in our society, and if they are happening in our society we should discuss them because we see people doing them so that we can help them. So voyeuristic disorder is a paraphilic disorder characterized by a pattern of sexual arousal from observing an unsuspected person who is naked, undressing, or engaging in sexual act. Yes, I've heard about this. Some people that are married calling someone to do sexual act, and then they are seated there watching. This one is called voyeuristic. But you see, this one, the other person is not unsuspecting. The other person is knows what he's doing and what he has done. But now, in voyeuristic, this person is with eavesdropping. Hmm? You see that? Let me repeat this. A paraphilic disorder characterized by a pattern of sexual arousal from observing or unsuspecting person, eavesdropping on a person when in the bathroom. This is a mental health problem that should be taken care of. Hmm? This voyeuristic disorder involves an intense sexual arousal manifested by fantasies, urges, or behaviors over a period of at least 6 months. Involve the observation of unsuspecting person who is one naked, is in the process of disrobing, engaged in sexual behaviors, and you are eavesdropping. So if you come across this person, know that this person may be the dopaminergic neurotransmitters in the brain have a problem and he needs to be taken to a person who is a professional. You can even do a brain MRI, do neurotransmitters chemical balance to see if dopamine is okay, because when we saw what we saw about dopamine in the brain is the one which balances pleasure and the other things that we talk about. You see, number two, the individual has acted on this sexual urge with non-consenting person, or this is where the forensics medical personnel and legal team comes in. uh, Acted, because when you act on sexual urge with an unconsenting person, see, that is like a rape case. So legal teams come out and forensics again come in. Or the second one is the sexual urge facilities can significant cause significant distress or impairment in social occupation. There are some problems that make even your occupation to deteriorate because you are used to them, or other important areas of functioning. You understand? The individual is at least 18 years of age. When this person is not at least of 18 years of age, you know, they are taken to juvenile schools. The key features here, we are on voyeuristic disorder. Voyeuristic disorder, we came from exhibitionist disorder, and we talked about exhibitionist. You see, this one is different. Yes. The key features here is a person is the person who is being eavesdropped or watched is unaware and non-consenting. Yeah, today you have everyone is very silent, no questions, no talking. Yes, because it's a funny topic. Yeah, that is how things are. Let's talk them as they are. You see, the person who is being watched is non-consenting, commonly includes masturbation during or after the act of spying. You look at this after the act of eavesdropping and spying and looking, when the other people are doing their things that you are eavesdropping, you go and sit down and start to fantasize. You get it? Unlike consensual, voyeuristic, consensual is whereby you've brought two partners and you are watching them and they have decided maybe you'll pay them, because I hear some people pay to watch. You see, this is different. This one is non-consensual. No one has consented you to drop and look at them. Hmm? No one. You get it? Hmm? It's very funny topic. These are the, but yes, beauty. You see, even if it's a funny topic, there are things that you've seen or heard that have gone on. And you see, when one day you will come and remember I talked about this, you will see it's a big problem. Or else, at times you have had them somewhere else or going on. So when you hear a couple has brought someone and they are watching, or there are two people and they are watching while they are doing their thing, know that they are mentally disturbed, and this is called voyeuristic disorder. They are not normal, because a normal thing, some things are done when someone is not watching. You get it? The cause in adolescent or earlyhood may be linked to early sexual experiences, impulse control disorders, childhood and trauma, or negligence. Don't neglect your children. Always be part of your children. Don't be a professional woman or a professional world, and you don't know how your children are going on in their social life. This is very important. You see, neglect, we have talked about neglect of children in mental health from the first day. So be even if you are so busy, be part of the children's world. And then there is the last one, which is dopaminergic reward pathway may be abnormal. Dopamine gives us pleasure or by illicit or taboo behaviors. There are illicit behavior that comes up with this. Now, here there are some others that you may confuse with this, like normal sexual curiosity, non-recurrent distressing or impairment, usually consensual. So, normal sexual curiosity when you are two and every partner has consented, that is okay. That is normal. It's okay. So everyone has consented. And then there is antisocial behavior motivated by control or aggression, not sexually aroused. People have gone to steal someone, they find their ladies, and then they rape them. You see, this is not it. This is a differential diagnosis. And these are the steps that forensic and legal teams follow to divide what is rape, what is not rape, what is a voyeuristic disorder. Has this person been undergoing a problem mentally that can stand the court or the legal constitutional uh, rights to speak about in courts? You see, these are how we differentiate. You see, other paraphilic disorder like exhibitionist frotteurism, we are coming on it. So we are going to see how they are diagnosed. But you see, mostly they are diagnosed based in clinical interviews, sexual histories, and behavior patterns. These are things that you cannot, mostly you can do only brain MRI or serotonin balance, but most of them are interviewed by the professionals, and they are people that are trained to differentiate these disorders. But treatment always as normal. Psychotherapy, talk to them, identify the triggers, manage urges, because everything that you feel, everything that you like doing, it's an urge. So you train to manage the urges. And then there is pharmacotherapy, that is drugs that will help the pressures to go down. And then there is legal forensic interviews when it comes to non-consensual acts of repeatedness offenses. Hmm? You get it? You non-consensual acts or repeated offense. Yeah? You see that? Thank you so much, Beauty. Good. There are summaries like age of onset, core behavior, duration, diagnosis, treatment, and legal actions. Now we go to the next one, because the management of all of them are like the same. When I get a different management pattern, I will I will say here. The next one is a froturistic disorder. Futuristic disorder. Now, this one is a very funny paraphilic disorder. Futuristic disorder. Have you ever gone to a bus which is full and then you stand and someone is always brushing against you? This is called futuristic disorder. We are talking about very funny topics today. I have to go through them because it's part of mental health disorder. If you are coming in right now, you have not gone through anxiety disorder, please go through anxiety disorder. Here we are now at futuristic disorder. It's a paraphilic disorder characterized by recurrent intense sexual arousal from touching or rubbing against a non-consensual partner. You get it? Typically in crowds and public places. In crowds, we are gone for a function and then you are standing and you are always feeling a person is rubbing against you. This behavior is intrusive and it is illegal. You see, this is where now forensic and legal issues come in and may go unnoticed or reportedly in an early age. This one is illegal. And we have seen so many people doing this in public. You see, it should be at least over 6 months or nearly 6 months. Hmm? Sometimes recurrent and intense sexual arousal from touching or rubbing against non-consensual person. You get it? Act on the sexual urges with non-consenting person or the urges fantasy causes clinical significance distress and impairment in social occupation. So when this thing goes on for long, when a person always wants to go to public crowded places and rubbing against people, you get it. And this person is at least 18 years old. We come to find out that this person may be having this problem, may be having this problem. And you see, there are some key features that we look at before we take this person for legal consensual, like typical behavior, rubbing genitals and butt thighs on strangers, very common to some people. Although you may think it is normal, but this is illegal, and we have seen some people being taken in because of these behaviors. Common settings always is public, buses, trains, elevators, crowded places. They like crowded places. There are people that mentally disturbed with this. Hmm? See, there are people that are mentally disturbed with futuristic disorder. You get it? Common settings we have said crowded places, buses, trains, escalators, supermarkets. Higher victim awareness, usually unsuspecting and they are non-consensual. When you are rubbing your genitals against, it's non-consensual. You see, duration, duration it may be at least 6 months plus. Stimulation shows physical contact, non-emotional or relational relational. Get it now? Psychology and causes, pathophysiology and causes. This one it may be linked to social withdrawal or shyness, childhood trauma or negligence, and then we have the behavior may be reinforced by sexual pleasure achieved. Get it? Through masturbation afterwards, creating a conditional pattern. Always masturbation comes in. Legal implication in this considered sexual assault. It's a sexual assault in many jurisdictions, often underreported by victims. You get it? Mm? Repeat offenders may be escalate to more aggressive behaviors in if untreated. So this is an illegal thing, but many people have gone to court and are in because of this. We can differentiate this or we can relate this. You may confuse it to normal consensual touch. Antisocial behaviors may be aggressive or directed, not sexually motivated. Other paraphilic disorder, you may confuse them like voyeuristic and exhibitionist. But you see, this one is it involves rubbing and touching, but exhibitionist it doesn't involve. And then we have the fourth one, which is sexual masonism. The fourth one, which is sexual masonism. Mental health involves so many things. I think states should bank on mental health because very many things happen uh, uh, because of mental health. Every sector is touched by mental health. So we are on the fourth one, which is sexual masonism disorder. Sexual masonism disorder. What is that? Have you ever come across this word? Hmm? Sexual masonism disorder. Have you ever come across this? Hmm? You see that? It's a paraphilic disorder in which individuals experience intense sexual arousal from being humiliated. Hey, my friend, listen. From being humiliated, being beaten, bound, or otherwise made to suffer. This is funny. It's very funny. Something that gives you pain, you enjoy it. Hmm? And you see, it's a matter of mental health, something that make you suffer. You're feeling pain, but you are enjoying it, either through fantasies, urges, or actual behavior. When these urges can cause significant distress or impairment, it's a disorder. Because the more you are beaten, you may get wounds. But you see, it's a masonism. Both who are doing it, they are enjoying it. Hmm? Mostly this one may not be illegal because maybe the people who are doing it are over 18 years or according to the state's constitution maybe 16 or so. But you see, this is according to mental health in a revised textbook or a revised Bible of mental health DSM-5. We will say it's a disorder. But how can we know this person has a disorder? Because once or twice does not mean this disorder is there. We are talking about sexual masonism. Masonism is getting into pain. Masonism means that. So, over a period of 6 months, every step we have talked about is like we relate it with over a period of 6 months or not less than 6 months. The individual has recurrent and intense sexual arousal from the act of being humiliated, beaten, bound, or otherwise made to suffer, as manifested by fantasies, urges, and behaviors. Now we know what we see is not real. It is some people are having problems mentally. They are sick. They are sick, and where they are, they should be treated. Lashes. I've heard of lashes. People having being tied, and then lashes here. Those people are sick. They need to be treated. They need to be taken to professionals to work on them. You see that the individual act on these urges with non-consenting person or the urges or fantasies cause clinical significant distress or impairment in social occupation or important areas of function. You see that the individual may take a consenting person to do this with him or her. You check it. Features of this arousal or suffering, pain, humiliation, or restraint. When you are humiliating a person, you feel nice. Hmm? Funny and crazy. Yes, they are crazy because now if you are feeling pain and they're enjoying at the same time, you see it's funny. Hmm? Now, things that we have seen online and on media is what we are discussing now as the reality. And you see, The people that revised the DSM-5 of mental health, they did research, and this research came out with this what we are talking about. So one day you'll meet these things with your partner, with someone who is your friend, or any person in the social class that you are around, and you will know how to work on it. You see, the activities may include spanking, choking, verbal degradation. Those are things we've had. Settings always is private or consensual with DSM practices, but becomes a disorder if non-consensual or distressing. Mm. Conscious risk may involve dangerous behavior. There is a very hard word here that people say that word is hard, as asphyxiophilia. What is asphyxiophilia? Asphyxiophilia. Let's see what is asphyxiophilia. You see, we are still talking about this funny sexual masonism. Funny thing. But today we have to talk about them because we have seen our children, our brothers, our sisters being involved in this. Asphyxiophilia is a specific type of paraphilia classified under paraphilic disorder. It refers to intentional restriction of oxygen to the brain for the purpose of enhancing sexual arousal or orgasm. You get? Hmm? You choke so that oxygen cannot go to the brain and then you feel good. This is funny. Right? Very funny. Only a disorder if causes distress and impairment. You see, very funny. Hmm? Now we continue to our topic of today. We are at that third one, which is not third one. This is talking about sexual masonism. Is the fourth one. It's the fourth one. Hmm? If these things cause distress in you, you see, it's a problem. Mentally, it's a problem. Yes, consent disorder only is distressing or involving non-consensual. So, if it is done by a person who has not consented it, you are beating a person, doing all those things, choking a person and while enjoying. You see, this is a disorder. Causes always early trauma or abuse, conditional experiences linking pain to social arousal, conditional theory. You link feeling pain to arousal, sexual arousal. That's a problem. Physiodynamic theory, seeking punishment as a way of managing guilt. You have done something. This one is always to partners, and then you feel you you seek punishment. In this way, the other way that we have talked about, choking, being beaten, as you make it out, and you feel that is getting away with guilt. You see that may be related to low self-esteem, depression, and need to control reverse. Low self-esteem. Imagine. Uh, so when these things go on for like 6 months or equal to or a period of 6 months, you will know there is a problem. And you see, associated risk, it may cause death because when we encounter asphyxiophilia, when we encounter that word, choking and causing low oxygen perfusion to your brains while you feel good, you may die because when an orgasm comes, you really need a lot of energy to your body to balance the nerves and the hormones. So you have been choked and there is not enough oxygen in your brain, you may die. And that's why you've had so many people have died while doing that act. So you see, it turns out to be a criminal offense. Turns out to be a criminal offense. So concurrence with a paraphilia like sexual sadism, fetish disorder, this may relate to sexual sadism and disorders. Hmm? We really need to talk to the public about mental health and the way to do things as human beings. We don't do things as more than animals. See, this is doing things more than animals. Hmm? We think it's a way to enjoy, while we know the frontal lobe is not releasing serotonin and the midbrain is not releasing enough dopamine, or the dopamine balance is not okay. And some people are doing these things and then you think it is normal. No, when there some people are doing some things, don't think it is normal or they are enjoying it. They may be suffering from uh, these neurotransmitters and they are recurrently doing things like this and they are paying people to enjoy. Hmm? You're being paid to enjoy the fetish of a person who has a problem mentally and you think it is normal. And these people are in professional areas. These people are the people we respect. They have money, they are loaded, they look well, they put well, they are intellectuals. But when it comes to these issues, they have a problem lying somewhere in neurotransmitters and brain behaviors. And then you think, I'm okay. You are not okay. Now I want to let you know, you need to know these people have a problem and they need to have psychotherapy. Now we go to the fifth one, which is sexual sadism disorder. Sexual sadism disorder. Always, if you have a question, please don't stop. Click it, and you have click it. You say hi. You say hi. I check to our private email address. I answer it privately or openly according to the way you like. Yes, we continue. We are going to now to the others. The others who are sadists. What is sexual sadism? Hmm? This is also a paraphilic disorder. See that where an individual experiences recurrent and intense sexual arousal from inflicting physical or psychological suffering on another person. Let me repeat. These things we learn them because as doctors we use them in forensics and legal issues. And you see, when you learn these things, when you are brought a case, you are ready to know to differentiate how to work out, because there are some people cannot be taken to the stand to be proven guilty if they have a problem in their brain. So when you hear someone has been taken to a doctor so that a doctor can prove this person is sane to stand a stand. These are the things that we go through. They are funny, but we go through them and we see which kind of sexual problem in relation to mental health does this specific person has. Because there are some that you've seen are illegal, there are some that are not illegal, but this person needs help because it is interfering with work or social behavior. Now we are in sadism. Is a paraphilic disorder where an individual experiences recurrent and intense sexual arousal from inflicting physical or psychological suffering on another person when these fantasies, urges, or behavior cause stress and impairment or involve non-consenting individuals. It becomes a disorder. You are inflicting fear. You are inflicting pain. You see, so that your fantasies, your urges can be accomplished. Hmm? You see, it becomes a problem if the individual has acted on these urges with an unconsenting person. You have not been consented, or these urges or fantasies are causing clinical distress. You see, normal. Every time I read about those two lines, the key features are arousal trigger, causing pain, humiliation, or fear. When you cause pain and triggers and fear, you get aroused. And then common acts, restraining, beating, whipping, burning, or degradation. Consent, critical. Here, there is no consent. In order, disorder, in only a disorder when acts on a non-consensual or can cause distress. Hmm? See that possible outcome can escalate to criminal behavior. It can be a criminal behavior. There is a severity spectrum which it may be mild, moderate, or severe. In mild, consensual role play without distress, not a disorder. You get it? Moderate, unwanted fantasies, casual handshake, or shame. Severe, acts on urges with non-consensual victims. You get it? There are some risk factors that may put this person on the spot, like psychodynamic theory, unresolved aggression, need for control or trauma. And then there is behavioral theories like early pairing of sexual arousal with aggression power. Then there is biological. We have talked about the frontal lobe anomalies, like when serotonin is not being released well, you start having these problems. Your dopa or level dopaminergic centers are not working well. You start having these problems. And then we have comor- comorbid conditions, antisocial personalities. You see those narcissism, narcissists, or paraphilic disorders. We talked about narcissists and paraphilic, other paraphilic disorders. The differential diagnosis the same as the others. Today we have the fifth. Yeah, we go to the sixth one. We have to finish this today. We have 30 minutes to go. Now we have pedophilic disorder. Pedophilic disorder. What do you think pedophilic disorder means? What do you think pedophilic disorder means? Pedophile. Pedophilic disorder. Pedophilic disorder. Pedophilic disorder is a paraphilic disorder characterized by intense sexual arousal urges or behaviors involving activity with pre-pubescent child or children, generally aged 13 or younger, at least for at least 6 months to qualify a disorder. You do it with young children, which is not okay. This one is a legal issue. This person should be taken in custody. Mm. Criteria according to DSM-5, there is criteria A, B, C. When you come to diagnose these things, to qualify, the individual has act or urges or the urges or fantasies cause marked distress. I am still repeating about that. Not person must be at least 16 years, at least 5 years older than the other. Now, because this is a legal issue and forensic problem, that's why we are discussing about it. Recurrent and intense sexual arousal fantasies urges, that is A, involving sexual activity with pre-pubescent children of less than 13 years for at least 6 months or above. B, the person has acted on this urge or they can cause distress or interpersonal difficulties. You get it? The person has acted on the urge or they can cause distress or interpersonal difficulties. And then we have C, the individual is at least 16 years old and at least 5 years older than the child. That is criteria. To prove this person has done is a pedophilic person. Subtypes sexual attracted to boys, girls, and both types are exclusive, only attracted to children, and the other one is non-exclusive, only also attracted to adults. See, key points: age, behavior, distress, consent issues, always non-consensual. Hmm? Distress may experience guilt, shame, or denial or harm. Then we have behavior, may involve fantasies, viewing child pornography, or physical contact. Yes, that's why we will talk about this one day. This one is killing the world. Mm, Pornography. It's a mental health problem that the topic is coming under, and the platform will have a professional who is doing research on that. That day I will introduce, and the professional will take over because there are some things that are under research that we really need not to talk about them, but to let the professional do what they know best. Age preference, we have said, is less than 13 years. Okay. Neurodevelopment, neurodevelopment, nerves and the brain, that is a risk factor. Childhood abuse, of course, is a risk factor. Personality traits is a risk factor, a very big risk factor. Poor impulse control, social isolation, and antisocial tendencies. If you see a person is antisocial and always isolated, please think about it because this person may be doing things that are not right. Hmm? As much as we talk about neurodevelopment factors, the dopamine receptors and neurotransmitters like serotonin, these people that are antisocial, we need to take them do an MRI and do the neurotransmitter test so that we can know if these people are okay. You get it? Comorbid psychiatric disorder like antisocial personality disorder, substance use disorder. We talked about substance and alcohol abuse disorder. Please, if someone did not go through that, go through that. It is recurring and recurring. And then we had other paraphilic disorders. You remember we are going through them, the other paraphilic. Now, because this is a legal issue, pedophilia is a legal issue. The first thing, this person should be taken to a professional to examine this person to know what this person did. Is he psych? Is this person normal? You get it? So acting on pedophilic urges is illegal and harmful, classified under child sexual abuse, be it consensual or non-consensual. We don't care. This is a child. Many with pedophilic disorder never act but may experience significant distress. You may find that these people that are pedophilic, they have a distress in them that is going on with them that they don't want to speak. And most of them, they may around others, but they may exhibit antisocial behaviors. Hmm? So mandatory reporting when a child is mandatory reporting when a child is harmed or risk is very important. When a child reports anything, this is very important. Possession of child pornography is a crime, and we should also talk about it when we need to, we see or hear about it. Diagnosis, we have said the diagnosis of this, clinical interviews. Clinical interviews, they are very important. Clinical interviews are very important. Nature of fantasies and urges, we should look at them. Any actual behavior, we should look at them. Psychological distress or impairment, you see. Risk assessment tools, we have them in hospitals, we have them everywhere. We should look at them. We should go through the people that are risk. Neuropsychological testing, we should look at them. And then we have psychotherapy as part of treatment. But there, after this person has been diagnosed, that will determine the treatment. But you see, if the person is above 18 years, it will be the person needs counseling, but to face legal issues. Legal issues. You see that? And then we go to the seventh one, which is called transversic. transversic disorder. Now, transversic disorder is another one. Transversic disorder. Hmm? You see, this is transversic disorder. Transversic disorder. What do you know about transversic disorder? You transverse. When you hear of a word called transverse, it's the opposite. So if it is the also opposite, what do we know about transversic sexual disorder? Is a paraphilic disorder characterized by recurrent or intense sexual arousal from cross-dressing. We have seen many people doing cross-dressing and they come public, wearing clothes of the opposite gender, typically for at least 6 months, associated with significant distress or impairment. Yes, you have seen people doing this. They are not, you feel they are okay, but it's a disorder. In Kenya, we have several, and they are celebrated, and every person thinks they are okay. Mm? Instead of being taken to the right people to be talked to and to be given treatment mentally, they are celebrated. Transversic is a disorder and it's under paraphilic disorder, which is a sexual disorder. The cross dressers, yes. Yeah, it's a paraphilic disorder characterized by recurrent or intense sexual arousal from cross dressing, typically for at least 6 months, associated with significant distress or impairment in sexual, occupational, or important areas of function. And you see, these people have a problem either mentally, medically, physically, or childhood traumas they may relate to, future or current characters that they are exhibiting. Mm. The criteria for diagnosis, criterion A and B, there are two: recurrent or intense sexual arousal from cross-dressing as manifested by fantasies, urges, or behaviors for at least 6 months or above. You see that? Mm? It's very fine and important. We go to B. The urges or behaviors cause clinical significant distress, impairment in social behaviors, or important areas of function. Yes, you see, very important, very funny, very important, and very funny again. Because it's important because we need to pinpoint them and help them. You get it? More common in biologically males. Those that, yes, it's common in biologically male, even female sometimes I've seen. May occur in heterosexual, homosexual, or bisexual individuals. Often begins in adolescence. Some initial individuals progress from arousal because cross-dressing to non-arousal gender expression or gender dysphoria. But this is not always the case. We talked about gender dysphoria, and cross-dressing is a complication that is, let me repeat about it. You see, this one is transversic disorder. It's a paraphilic disorder characterized by recurrent and intense sexual arousal from cross-dressing. Cross-dressing, but gender dysphoria, we talked about feeling as if you are another gender, feeling as if you are another gender, or doing things as if you are the other person, the other gender, even talking. You see, yes, sometimes we have with fetishism, arousal in specific related to fabric, texture, or garments, with autogynephilia, with autogynephilia, thoughts of image of waachilie na waendelee na dawa na umpe TCA 1 month, dawa zenye alikuwa na meza. Yes, onset as female and in male. Okay, important distinction, motivation. These ones are important things that you really need to look at when you get to see this. Important things that you need to. These are important things that you need to look at when you feel, you see. You see these things. Hmm? What motivates transversic disorder? You see, it's a difference between transversic disorder and gender dysphoria. Sexual arousal. The second one is identity mismatch in gender dysphoria. And then cross-dressing in transversic disorder is erotic. But in gender dysphoria, you are identifying yourself as just that gender. You are identifying yourself as a man or a woman, and you are a woman or a man. You see? And then distress from urges behavior, from being in the wrong body. Yani, you see, distress from urges behavior, the behavior that you have. Mm? And then from being in the wrong body. Yes, in the wrong body. Mm? Wait a minute, someone really texting me here. Now, and then the goal is gratification. Sexual gratification in transpheric behavior. You are gratified sexually. And in gender dysphoria, gender transition and acceptance. In gender dysphoria, you are transiting. You want to be a woman and you are a man. But in other, you you want in transversic disorder, you want to be gratified as a woman. See, now we go on. The last one is fetish disorder. Fetishistic disorder. You see some things that we talk about in normal lives nowadays. In mental health, these things are disorders. Hmm? We talk about them in mental health, but they are disorders in the other way. So you see, my fetish is when we come to sexual behaviors. People talk about fetish and they like doing them, and you feel it's normal. But you see, in mental health, these are things that we talk of as disorders. They are things that we talk of as disorders. So I think people nowadays do things that are wrong and are disorders, and they think they are normal. They are celebrating the wrong things. Hmm? So, fetishistic disorder is a paraphilic disorder characterized by recurrent and intense arousal from either using an unliving object, e.g., shoes, underwear, or highly specified focus on an genital part, e.g., feet, hair, lasting for at least 6 months and can cause significant distress or impairment. We see that fetishistic disorder, recurrent intense sexual arousal from either the use of non-living objects like hair, shoes, or highly specified focus on genital body parts, or impairment in social occupational. Sorry about that. Now, the criteria, how can you know this person has this problem? How? Recurrent and intense sexual arousal from use of non-living object or highly specific on, of non-genital body, as manifested by fantasies, urges, or behaviors for at least 6 months. The sexual fantasies, that is B, or behavior cause clinically significant distress in impairment in functioning. Hmm? The fetish objects are not limited to articles or clothing used in cross-dressing, as in transverse, or devices designed for genital stimulation like vibrator. You see that? That is C. The fetish objects are not limited to articles or clothing used in cross-dressing, or devices designed for genital stimulation. Just imagine, like vibrators. Hmm? Fetish. Common fetish objects or body parts. These are the common ones: underwears, shoes, leathers or rubber items, gloves or stockings, fabric, e.g., silk or fur. Hmm? Body parts: hair, feet, toes, ears, and hands. Yes, you see. Very funny, very funny, very funny. We should pray for the world. Epidemiology more commons in males, typical in adolescent. May be long life. Causes psychodynamic theory, fetish as a symbol of representation of unconscious conflict, control, castration, or anxiety. Behavioral theory and neurobiological theory. You see, in biological, early sexual experiences paired with objects or body parts that later become social and arousal. When does this thing become a disorder? When? When does this thing become a disorder? Distress, guilt, shame, and fear. Hmm? Interpersonal problems. Functional impairment, inability to engage in regular sexual activity without the fetish. That one I will not expand to it more. Inability to engage in regular sexual activity without the regular fetish. You cannot do it without having your vibrator there. You cannot do it without having your Samantha there. Differential diagnosis, the others like transverse disorder, obsessive compulsive disorder, autism spectrum disorder, may involve repeated use of object focused behavior but not sexually motivated. You see, kleptomania, impulse to steal, not sexually like that. How does it present? Secretive behavior, e.g., hiding fetish items. Masturbation involving the fetish object. That one that people use, if you are masturbating now, you know, may feel compelled to use a fetish for arousal. You see, funny. Often have difficulty in relationship due to preference for the fetish object of a partner. You see that? Distress used to guilt, shame, or fear of discovery. Now, see, when you are fetish of something, your relationship could be under a problem. So you need help. As we've talked so much about help, we've talked about psychotherapy, pharmacological treatment, drugs. Fluoxetine always comes in and sertraline. Anti-androgen, medroxyprogesterone in severe to reduce libido. When you have high libido, you anti-androgens, you use medroxyprogesterone. Yes, so that they reduce it because this thing is making you mentally sick. Yes, and it is taking time for other things. Hmm? You see, there are some things that you may see like object of arousal, non-living or body parts. Those ones, you will start being confused by non-living things, objects of arousal, anxiety. Hmm? And then we have other unspecified paraphilic disorders, necrophilia, sexual attraction to corpses. Imagine, just imagine. So when you hear some people have gone to do this in the mosques and they pay, and you feel it is black magic or is something called, I don't know how they call it, juju. Hmm? It's not. They have necrophilia, a problem, mental problem. Zoophilia, sexual attraction to animals. Imagine. So when you feel a person has this problem, zoophilia, you get to understand that this person has a problem mentally that we need to talk about. And then we have another called urophilia, sexual interest in urine. I've had some people you do it when they do that act, and then you feel that it is okay. No, it's a problem. Clismaphilia, sexual arousal from enemas. You see, things that you see online are sexual complications, but people celebrate them and they be surprised when you see them. Hmm? Those are funny issues. These are issues that are biologically having a problem, neurodevelopment issues, hormonal imbalances, psychological, early childhood traumas, conditional, and personality disorders. You see, social environment and poor social act. Hmm? See that? Hmm. Poor sexual socialization, abuse, and experiences in childhood that will lead. We should, all these things that I've talked about in paraphilic disorder. Hmm? All these things that I've talked about are problems that should be addressed. Hmm? Are problems that should be addressed. And these problems are not just problems that we sit down and we look at them. These are things that we really need to talk to. When now you know this is a problem that it's a disorder. You should look at it and take control of it and talk to someone. Hmm? Stop sexual masonism. You've seen masonism. Stop voyeurism. Hmm? You get it? Sexual masonism. You make people suffer being hit and you're feeling good. No. If someone is attracted to this, please talk to that person so that this person should stop anything that is coming out of this management. Psychotherapy is important. Talk to that person first because after 6 months of noticing this person has this problem, you need to talk to that person. Hmm? You need to talk to that person. You need to tell that person whatever that you are doing is not okay. Please change. Because as people celebrate it like behavior, fetish behavior, as we have seen, fetishism, fetishism behavior as we have seen. Hmm? We celebrate fetish and you see here, DSM-5 says it's a problem. Hmm? So legal and forensic intervention, court mandated therapy, registration and monitoring in the pedophilia. Register if you feel there is a pedophile somewhere, register, go to legal offices, register, I'm suspecting, so that monitoring should be started. Because you know the risks that come out with pedophilia. Very bad. Very bad. You see, nowadays I look at things, and then you look at some things that are being celebrated, and you know they are mental health problems, and then you just say, "God help us." Hmm? Very bad. Now, we were to talk about paraphilia, but paraphilic disorder. Let's see what is paraphilic disorder. What is paraphilic disorder? Because you see, paraphilic disorder, we may talk about it next time as we see what is paraphilic disorder. Paraphilic disorder and mental health condition characterized by intense, persistent sexual interest are outside the norm and which can cause distress and involving risk of harm. Paraphilia becomes a disorder only if it causes this significant distress or harm to others. But you see, we, we need to know the difference between paraphilia and paraphilic disorder. Before I finish this topic, we need to know the difference between paraphilia and paraphilic disorder. Because that is important. What is the difference between paraphilia and paraphilic disorder? What is the difference we see? So that next time when we start on paraphilic, someone know what is the difference. Hmm? In definition, atypical sexual interest, paraphilia, and paraphilic A paraphilia that causes distress, impairment, or harm to others. You get it? Clinical significance may not require clinical attention. May not require, in paraphilia, it may not require clinical attention. Hmm? But paraphilic requires clinical diagnosis and possible treatment. Distress and impairment not necessarily in paraphilia, but present too in paraphilic disorder, self or to the others. Consent involvement may involve, paraphilia may involve consenting to others, may involve non-consenting individuals, e.g. pedophile voyeuristic. Now, tomorrow we'll go through paraphilic disorder. I think our time is up. And then, if there is no question as usual, be blessed, stay cool, and God bless everyone. Let's meet tomorrow as we talk and conclude paraphilic disorder.